Good evening, and thank you for taking time out of your busy Thursday evening to join us for COVID-19 Conversation Session 4. In this session, we'll be talking about the impact of COVID-19 on women of color. I am Dr. Maya Williams. I am a health disparities researcher, an industrial and organizational psychologist, and an assistant professor in the Donald and Barbara Zucker School of Medicine at Hofstra and Northwell Health. My lovely co-moderator is Dr. Alison Myers. She's an endocrinologist at Northwell Health and an associate professor in the Donald and Barbara Zucker School of Medicine at Northwell Health, Hofstra University. It's nice outside. The weather is beautiful. Everybody wants to be outside. Everybody has forgotten that COVID-19 is actually a thing. But earlier this week, the US reported a record single day spike of 60,000 new coronavirus cases. And that should be enough to let people know that coronavirus is still very much alive, even though it's in Arizona, California, Florida, and Texas. New York City is still at risk of having many infections. And as usual, Black and Brown people are still most disproportionately affected by COVID-19. In fact, the New York Times reported just earlier this week that no matter how you slice the coronavirus or the coronavirus pandemic, Black and Brown people are still severely affected by coronavirus, whether that be in a city, in the suburbs, in counties, by age. Black people make up 28% of the population, 22% of the population, but at 28% of the number of COVID-19 deaths. Hispanic individuals are 29% of the population, but make up 34% of the COVID-19 deaths. It has often been said that the face of COVID-19 is women of color. And many people usually ask, why is that? And the reason for this is because of our intersectionality, because of the color of our skin, because of our ethnicity, and because of gender. We usually carry the brunt of many things in society, especially public health crises. In general, African American, Hispanic, and Native American communities tend to have higher rates of pre-existing conditions that are associated with an increased risk of COVID-19. These conditions are heart disease, asthma, diabetes, and of course, they have lower rates of health insurance. Women, and especially women of color, are more than likely to live than men to live in poverty, and we do not have time for that, especially at a time when grocery stores and food banks are in shortage. Women of color are overrepresented in some industries that experience significant job losses, such as childcare and hospitality. Women of color are also more likely to start their own businesses, and as a result of that, COVID-19 did impact our way of life. If we have not lost our jobs, then we're still more than likely to work on jobs on the front lines. We're still likely to be nurses, we're still likely to be doctors, and we sometimes do not have the option to work safely at home, nor do we have the option to social distance. Among women who do remain at home, some may experience unsafe conditions due to domestic violence. As we can see now with what's going on with international students, immigrant and undocumented women who may face limited resources, language barriers, and a fear of deportation usually do not go to healthcare, do not go to the hospital, or are afraid to get access to care. Finally, we've all heard the president refer to the coronavirus as the Chang flu because it originated in China. And as a result of that, Chinese, American, and other Asian women, they're seeing a rise of xenophobia with racist threats and attacks. Before I introduce our esteemed panelists who will be talking to us today, I just want to say thank you to the Black Educators Community Inc. for supporting us. Also, thank you to Dr. Naomi Maria, who's always been by our side to help us put this thing together. Mrs. Tiffany Harden, who's in the Facebook Live chat right now and who's going to see our questions. The Department of Medicine at Northwell Health, and the Center of Health Innovations and Outcomes Research. To introduce our panelists, and I'll hand it over to Dr. Alison Myers in a while, and the panelists to say a little bit more about themselves. We have Dr. Carmen Rodriguez, who is an OBGYN practicing in North Shore at Long Island. We have Ms. Tiffany Foster, who is a licensed social worker and a COVID-19 survivor. And we have Ms. Simone Wilson, who is a career coach and organizational leader. And I'll now hand it over to Dr. Alison Myers to start with the questions and have the panelists introduce themselves.
Good evening, Maya. Thank you very much, Dr. Meyer Williams. So hello, my name is Dr. Allison Myers. I am the medical director for inpatient diabetes at North Shore University Hospital, and I'm also an associate professor in the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Today, our topic is focusing on women's health, and I am so excited for these three wonderful women that we have up here. This is some serious hashtag Black Girl Magic.
Yeah.
So we're going to go around in no particular order. I'm just going to start with Dr. Carmen Rodriguez. If you can give us a little 5-second blurb about who you are and what you do.
I'm an OBGYN, like she said. I practice obstetrics and gynecology in Manhasset, and I have privileges and I work very closely at Long Island Jewish Medical Center. And I do other things like I'm the chairperson for the Women in Medicine at Long Island Jewish Medical Center. I have a mentoring group for women physicians. I'm a mother of 3 boys. I'm married and I'm happy to be here. Thank you for inviting me.
We're happy to have you. Thank you. And next we will go to Miss Simone Wilson.
Hi, my name is Simone Wilson, and as indicated, career strategy coach and organizational development leader. So I have 2 lives, I call it. By day, I do organization development work, and I also have my own coaching and consulting practice where I do career coaching and workshop facilitation, and just really looking forward to this opportunity to share and learn.
Thank you. And last but not least, Miss Tiffany Foster.
Good evening, everybody. I'm a licensed social worker in the state of New York, with focus on the mental health shelters in the city of New York. So, and I'm here to share my story and, speak to whoever will listen.
Speaking of which, we're going to start with you as we traditionally do. We have our people who have survived COVID. Thank you so much for having the courage to come on. We always have people start by telling us their COVID-19 stories. So Ms. Foster, if you can do that, we'd appreciate it.
Sure. So I'm somewhat of a hypochondriac at times. And when this whole pandemic started, I was a little, nervous as any other individual. April 17th, which was a Friday evening, I began to feel slightly feverish. I reside with my mother and my brother, and I told my mom, I'm a little nervous. I don't know what's happening. And went to bed, woke up the next morning, the fever persisted. And then that's when I kind of knew something was, wrong. I scheduled my exam that Sunday morning, and I was tested positive. It happened in cycles pretty much and in steps. Firstly, it's just the fever. You might have a mild headache for me. I began to lose my scent, my taste. My teeth started to hurt every time I would eat. And I thought that would pretty much be it for the time being. I was sadly mistaken. That grew into just sleepless nights and difficult to breathe. It became very difficult breathing. That was when I became very nervous and scared. And that just persisted for days at a time. And the fever would not stop. The fever was endless. And I did not go to the hospital. However, during my being symptomatic, my mother became symptomatic, as did my brother. So the whole household was tested positive for COVID-19. My brother, unfortunately, he did go to the hospital, but he is still with us. He did go to the hospital. He's fully recovered. We have all tested negative, but it definitely was an adventure. Definitely, it really plays with your mental as well.
And you bring up something that we've heard commonly. A lot of people of color have fear about going to the hospital because there have been some rumors that if you go to the hospital, it's an automatic death sentence, and that people of color are more likely to be killed in hospitals. So can you comment on that?
Sure. So for us, we were watching the news. I was looking at Instagram, RIP this person, RIP that person. And that became just terrifying. So we had a rule. We did not want to go to the hospital. That was what we were going to do. We were not going to go to the hospital. With that, our symptoms became worse. And what we started to see was that we were hearing people were treated differently. The ventilators, people were going on ventilators and they weren't making it. Unfortunately, our tenant passed. He was on a ventilator and he then passed because of that, because of the ventilators. And my experience with with doctors were very different. When I became symptomatic the first time, when I firstly became symptomatic, I immediately contacted my doctor. He works with a larger hospital, and he was deployed to the hospital because of the COVID, to take care of COVID-19 patients. I was then linked with a Caucasian doctor. She was very nice, but she wasn't, there was a lack of sense of urgency for me. And I just was growing uncomfortable with feeling like I couldn't really share my details with her. Um, a week into it, I then was linked to my mother's doctor, who is an African American or West Indian. And my mother is also of Jamaican descent. So for me, I identified with him more, and I became more comfortable with him. And he was a little bit more attentive to my needs. And moving past that, my brother's experience in the hospital as an African American, he was, depending on who the doctor was on that shift, the conversation was very different. So you had one doctor that was introducing chloroquine to him, and we all know what we've been hearing about that on the news. And then we had another person, another doctor come in and say, hey, we should try this. We had another doctor come in and say, hey, we should try this new medication. So it was kind of, we couldn't help but feel that, our loved one was being taken as a guinea pig. He essentially got treated with plasma from someone else's blood, and he did make a full recovery. But that just goes to show the hesitation that people of color feel when they're going to enter the hospitals. We don't know how and who is going to be taken care of, and if they're equipped with our culture in our community.
Carmen, as the president of the Medical Society and as someone who works in the hospital, can you comment on what's been going on in the hospital through the lens of a physician?
Okay, definitely I can. I just want to mention to Tiffany that part of the reason why maybe that particular instance that you had different medications being offered is because COVID-19 is an unknown to us, to all areas. I mean, my expertise is mostly in obstetrics, and that's where I was. But I do know that with COVID-19, there is really not one thing that has been said to be the most helpful, especially in the beginning. It was something so new that doctors were trying different things. Regarding how patients were treated, with my experience at LIJ, I did know that initially there were so many patients that were coming through the door, where the hospital, as not only LIJ, but most of the hospitals in the city, they were completely overwhelmed. And the patients that were to stay in the hospital were only patients that needed oxygen, either oxygen or intubation. Most of the other patients were given instructions and to go home. It is true that, for example, I know personally that at LIJ, like in most other hospitals, patients were intubated. About 70 to 80% of the patients that were intubated were not able to be extubated. About 20% did, and some stayed intubated for many weeks. So I do understand the fear. We have a history as people of color to fear even more because of the experiences that we've had in the past and historically. But definitely we need to educate everyone that currently the hospitals are in a much better situation in New York State, but we still need to be vigilant and protect ourselves by using masks, hand washing, because COVID-19 is so new and we still have so much to learn. We're not sure, how, even though we've done so well, we don't want to go back and have the same mistakes. I hope I answered your question.
Yes. And I think another issue too that we've been noticing, I know I have seen it as someone who works in the hospital a few days a week, is that people who have other chronic conditions who don't have COVID are scared to come to the hospital as well because of fears of developing COVID. And I unfortunately saw a woman who wasn't much older than I am who had an infection, and she actually ended up turning into needing an amputation because she waited too long to come in out of fairs. So I think that, this is real, whether, it's what Tiffany and her brother experienced, or what other people, experience, or what they've heard, is that it's about getting the word out. That, I mean, I can say from my own experience, I didn't see anyone trying to kill anybody. But again, it comes back to what Dr. Rodriguez said. People tried everything, and it did seem like people were guinea pigs. You're totally right when you say that, because nobody really knew. We had very limited data, and it was like every day we were finding out that COVID did something different. And so, going back to your point, Dr. Rodriguez, it was a very trying time, trying different treatments, but it's wonderful that you two got better. Another group of women that have been very, very concerned are pregnant women. I know I have a coworker who was pregnant during COVID, and a lot of women are very concerned about maternal to fetal transmission, which in lay people's terms is, what are the chances of me passing COVID on to my child? So can you comment on that?
Yes. So far, the limited information that we have, as there's not a whole bunch of data in pregnant women, we've only had COVID for a few months, right? Probably maybe 6 total, but there have been, to my knowledge, no transmission from mother to baby. In none of the patients that I took care of, none of the patients that I'm aware at the hospital that I worked, and from the studies that I know out there, there hasn't been really a transmission. What was happening at LIJ when we deliver patients that I deliver, many that were positive, the babies were tested twice over a period of 24 hours. And I don't recall any patient having any baby have a perinatal transmission.
And then as a follow-up to that, how do mothers deal with coping after having a child? There's stress of dealing with that, whether it's baby blues, or some women unfortunately develop postpartum depression. How can you get support in a time like this when you have to be socially distant from people? I mean, some hospitals got to the point where they weren't even allowing the partner in the room during delivery.
Absolutely. I think it's totally unrecognized, postpartum depression, especially in our minority patients. But one of the things that was done was to, luckily at LIJ, we never stopped the husbands from coming. We did have some restrictions where they would come for the labor part and then leave for postpartum at one point. But throughout the whole COVID height of the pandemic, the husband was always allowed, just probably not allowed in postpartum. And then after a few weeks, they were allowed to stay for the whole time. The isolation, I did notice that our social workforce was present. The nurses doing rounding will identify patients that had not only risk for anxiety, depression, social issues, problems, abuse, and they would be referred to the social worker. We do have at Northwell a very robust perinatal postpartum depression, which is 718-470-4 and they can call either as an inpatient referral or as an outpatient referral. There are other programs as well. There's a program to call, let me see, I believe it's safety care. And when the patients are referred, they actually get a visit. Within that program, there are several visits. One is they follow the patient for 30 days. During COVID, they could not go and do the 2-hour visit that they go through the patient, everything from depression, problems with food, referral to WIC, assistance with childcare. We're not able to do that, but they had programs of calling them. They would call them on 24 hours, then a call at 48 hours, then a call within a period of 14 days. They had 4 phone calls and they were able to be referred for that.
Thank you for that. So obviously for women who've just had babies, that's a lot of stress. But for our working moms, the moms that are out there, they obviously have stresses. And I'm going to pose this question to you, Ms. Wilson. Recently in the New York Times, there's an article that published noting seeing some of the disparities in pay for women. So for every dollar that a white man makes, Black women make only 62 cents, Native American women only make 57 cents, and Latina women only make 55 cents. And as we know, during COVID, there was a lot of highlighting of our low wage jobs because a lot of people who have low wage jobs were still working. especially like our delivery service, cashiers in the supermarket. But there was also a large number of us that were furloughed or laid off during this time. So what can companies do to help ensure that they're supporting us as women during these times?
I think for companies, the key starting place is for women who are still in the workforce, definitely ensuring that health and safety becomes priority. Is the work environment conducive to overall health and safety? Are practices put into place? And also, what are equipment or supplies that are available if you're in the workplace? Do you have the mask? Are there sanitary precautions in place to help ensure that each and every staff member is safe? The second piece I'm going to say is really around the policy of the company, looking at what you had and also starting to look at, okay, what's needed in light of COVID-19, what are some of the policies you might have to go back and amend that's going to help to protect your workers? And also, for some cases, you might have to look at compensation. What are compensation packages that need to be in place? And also, what are different, could it be time off, whatever that looks like. But I think the two pieces I would really add is really looking at health and safety overall. Is the workplace really conducive to the health and safety of individuals? And do they have all they need to be able to be safe in that environment? But also going and looking at your policies to see what's there, because it's one thing to have it written, but is it really being practiced and it's in the best interest of your workers? Because otherwise, you're not necessarily going to get full work because they're concerned about their health, they're concerned about their family. And if they're not feeling as if the workplace is the best place, then that's an additional stressor that's added to already complicated situation and condition we're currently experiencing.
And what advice would you have for someone who unfortunately doesn't have a workplace, who's looking for a job currently? How would you recommend they pivot into trying to get back into the job sector?
I think for someone who does not have a job, I think is the first thing I would say is definitely make sure you're okay, ensuring that your personal health and safety, because I think I'm very much aware of the financial implication and just overall impact. But I think they say when you go on an airplane, put your mask on first, because you're not going to be able to help anyone if you yourself, you're not in the best place. Then once you have that opportunity to really assess the situation, the loss that you've experienced, take inventory of your skills. What's your employment history? What are the skill set that you have? And also look at transferable skills, because I think a lot of times we might say, well, I've only worked in this environment, so this might be the only place. But looking at your transferable skills to say, okay, what are some of the skills that I have that could be transferred to another industry? I think in light of COVID-19, there are some industries that are opening up. So start looking at some of those job descriptions to say, okay, what are they looking for? What do I already have? Because I think sometimes we tend to focus on what I don't have. Look at what you already have and how can you then utilize and leverage what you already have in your background, your experience, the learning that you've been doing. How can you utilize that to pivot and position yourself for the next role?
Maya, I'm going to turn it over to you. We have a question in the chat.
Yes. So the question is for Dr. Rodriguez, and would more education on research as well as education on what to expect when you go to the hospital help to reduce the fears of people of color?
Absolutely. Definitely, one of the main movers in anything that you want to do is education. So one of the things that systems can do is not only educate the community, but also educate their healthcare workers and their force, so that they are aware of things that can impact healthcare. So absolutely. And I know there's task force, which is the severe morbidity and mortality task force in New York State. I believe that Governor Cuomo formed in 2018. And what it is a task force that gets together and gives recommendations. And one of the recommendations that was part of that task force was to educate healthcare workers, educate the patients in hospitals, and look at the areas that are needed, and also keep a track of the morbidity, mortality, and also give education to see how we can make changes in that. So the answer will be yes. If patients are educated and the community itself is educated, they'll be better able to not have the fears that they have. Right now, I can say that a lot of patients are afraid about going to the hospital, but I would say that New York State hospitals at this state are a lot safer than they were months ago. And with the infection rate being less than 3%, definitely don't delay your care and don't be afraid. You can empower yourself by having someone to advocate for you. If you don't feel comfortable, you could always ask for a second opinion. All the hospitals have patient care advocates. They have by law, to help you with translation, and also if you ask for a patient advocate so that you feel safe. And like Dr. Myers said before, there are a lot of patients that are coming sicker or they're staying away because they're afraid of COVID. But we are in a recovery phase, and you should, if you need the help, you should get it. As well, you should also take advantage of calling doctors that can see you remotely and can tell you, if you're having a problem.
So to Ms. Foster, as a follow-up to what Dr. Rodriguez was just commenting on, have you had to get aftercare? Were you able to get good access to care following your completion of your treatment?
Yes, following the symptoms, I immediately went to the doctor in person. He took my blood, and he had a conversation of what I currently felt like. He explained to me that, many people that have been infected by COVID-19, they will be affected long term. Maybe joint pain, maybe just extreme fatigue, something like a long haul. So I think that he educated me on what was to come, what I will experience. And, I've built a different rapport with him now, knowing that he's taking care of me, through my symptoms.
And that's a really good point, because I've seen a lot of people say, well, a lot of people don't have to go to the hospital. What's the big deal? It's not a big deal. But like you said, there are people who did not ever have to go to the hospital who have long-term effects, whether it be the COVID feet, which you get little small blood clots in your feet and it can cause chronic pain. Like you said, the joint pain. Some people have some memory loss that can last for quite some time. A lot of people have been having mood disorders after dealing with COVID, like you said, the fatigue. So I think those are very salient points. I'm going to turn it back to Maya. We have another question in the chat.
Yes, I guess this is an open question. Somebody asked, Brianna asked, what are your questions for people traveling? Do you recommend people stay put as the cases are rising?
That's a good question. Do you want to give us an answer, Dr. Rodriguez?
Well, I think definitely with the cases rising, we should definitely stay put. I mean, you could definitely enjoy going to the parks, distancing, traveling with your family within New York State to areas which are different from where you are, but I would recommend open spaces, nature, staying with people that it's, less than 10 people, not going to other states, especially with the rising number of cases in other states. We're hoping that New York State can stay the way it is and just get better. So traveling to other places increases your risk of contracting the virus and continuing the spread.
There was another question that someone had broached about in terms of another issue that we have as Black women in terms of mortality, going back to the mortality point about Black women in childbirth. And I think it's salient to bring this up because, as most of you know, there was a young lady who passed away at a hospital in Brooklyn at the age of 27 or 28. It was very heartbreaking. Her poor partner now has to raise this beautiful newborn by himself. And this has been an ongoing issue in our community where women are dying in childbirth. We see this over and over again. And this is separate, obviously, from COVID, but I think it's something that, we don't really talk about a lot, which is also increasing the mortality in this community in a disproportionate way. So Dr. Rodriguez, can you comment on that?
Definitely. I think the morbidity and mortality for women of color falls in the same pattern that everything else has been kind of like unveiled, all the inequalities in which racism plays a great part. Why? Because it goes through the determinants of health, the socioeconomic status, the zip code where you live, which hospital you go to. We do know that it's not that the hospital is a bad hospital, it's that hospitals don't necessarily have all of the resources to be able to provide the care of women that have a higher risk of having morbidity and mortality. Um, so a lot of the factors that I believe impact women of color is those factors: education, socioeconomic status, pre-existing condition, uh, and the care that you get depending on the hospital that you go. Even when you sometimes put aside all the different kinds of determinants of health or characteristic or comorbidity, women of color still have higher risk of dying while having a baby.
And just to put it into numbers, the United States ranks 55th in maternal mortality internationally. And I always just find it interesting that an island such as Cuba does much better than we do, ironically enough. And then just to put it in numbers, for every 100,000 live births, 13 white women die, 11.4 Hispanic women die, but 42.8 African American or Black women die. This definitely has to take a toll on us as a group. And since we have two social workers here in the room, I would ask if you guys can also comment on this, the way we can deal with this and how it can affect our psyche.
If I could also comment, I think one of the things that could definitely make an impact would be programs in which women end up coming back to the doctor sooner than the 6-week checkup. The availability of OBGYNs to have a connection with a primary care physician for those women so that they are not only coming healthier to the obstetrician due to chronic conditions that are well taken care of, but if they are identified during labor and delivery, to then follow up with primary care physicians in cardiology, internists, family practice doctors that can follow them and take care of those, high risk patterns, which especially hypertension, which is one of the main causes of morbidity and mortality for women of color.
Ms. Foster, I think you were going to say something.
Yes, I think that being a social worker, I think that a lot of us, we focus mainly on intervention. And most of the time, sometimes we need to just close in on prevention. How do we prevent these things? You clearly told us the statistics, the numbers. Now that we've been educated on that, how do we use and focus in on our evidence-based practices and look and make changes? We need to fine-tune the things that need to be changed. That number, I haven't heard it that way. It's very high. And we need to really get together and utilize our resources in our communities. Who can collaborate with who? How do we strengthen our representation in these hospitals? How do we do that? When we go to these hospitals, I don't know numbers, but there are a lot of Caucasian doctors or what have you, and that's fine. And you have just as many African American doctors. However, are they looking at these numbers as well? Are they learning how to prevent these deaths? I think that's just what we have to look at.
Dr. Williams?
Yes, so one of the questions is for Dr. Rodriguez again, can a baby have immunity from breastfeeding if the mother had COVID-19 previously?
We don't really know per se, but we do know that if the mother is positive, she can breastfeed. We recommend not to put the baby directly to the breast. The breast is clean. the milk is pumped, and then the baby can have the milk, but not directly exposure, especially when the mother has been very symptomatic. She has to wear a mask around the baby and not be in contact with the baby while breastfeeding, especially if they're sick. Regarding antibodies, as you know, the studies now are showing that we have antibodies, and patients who have been very symptomatic have antibodies for a longer period of time, and patients that were not asymptomatic, the antibodies that are positive are lasting less. So we still have, it's a lot to learn. So I am not sure that if antibodies in the milk are even passing in the milk and if they're giving prevention to the babies. But I would just give the advice that yes, it does have other benefits as always before COVID. It decreases allergies on babies. It increases the functioning of the milk in the intestines and the babies having better digestion. And it does have immunity for it does protect some immunity due to the mother's antibody for other diseases. So I would recommend breastfeeding and just to follow those precautions where it doesn't get directly attached to the mother's breast if the mother is symptomatic and positive for COVID.
Dr. Williams, do you have any other questions from the chat?
None as yet, but would like to encourage the participants to start asking questions. Actually, I do have a question now from Ms. Green. The question is, how are hospitals working with community organizations to address the mental health concerns that are more prevalent due to the pandemic? Very good question.
I do know that at LIJ specifically, they're working very closely with Sucker Hillside Hospital. They have opened up a lot more avenues for healthcare workers and the community as well to participate due to the increased depression and isolation and increased anxiety. There definitely is an increase in the community. Patients that have had problems prior are probably getting worse, and patients that never had problems before are having it now. But definitely, there definitely needs to be more communication between communities and hospitals to reach out to all the members of the community that need it.
I would like to add to that as well. I think Simone touched on it previously. A lot of the mental health issues that we have in the Black and brown communities is sometimes due to the stigma that's attached to mental health. And I believe July is mental health for minority individuals. Simone said earlier that we should definitely take time for ourselves because, you know, there's so much out there that it's like, I know growing up in the Caribbean, it was always go and pray about it, or did you pray about it? And sometimes that, like, we don't want to hear, did you pray about it? Because maybe we have prayed about it over 1,080 times. So it's all about trying to pace yourself and trying to understand that we're all living in a pandemic right now and you will burn out. So it's all about taking time for yourself. It's all about just realizing that I'm going to get fat and that's what it's going to be. I'm going to get fat, I'm going to get fat. And I don't really care if I get fat. Because I'm in a pandemic and there is no rule book as to, you know, how to go about and deal with the pandemic. But the most that you could do is there are a lot of resources online. There are a lot of podcasts online. If you're not into podcasts, get into therapy for Black girls. She just gave, like, write a letter to yourself, be kind to yourself, tell yourself that you're doing the best that you are doing despite the circumstances. While you might be applying for jobs and not getting any jobs, it's not a reflection of who you are, but it's just that, unfortunately, look at who's our president. Look at who, you know, look at what is going on right now. Everybody is suffering. You're not in this alone. Talk about it. If you have to form a group where you have to pray about it if that works for you. But make sure that you reach out to a friend and say, hey, today I'm not doing well. And if you feel like just not going to work, not talking to anybody, just take time for yourself. That's the most important thing you could do, is to take time for yourself and be kinder to yourself.
I just wanted
to say, I was going to say for our social workers, but go ahead, Dr. Rodriguez.
Oh, I'm so sorry. I just wanted to say that you're right. July is the month for mental health, and especially for us, people of color, is I believe it's called BIPOC, and it's Black Indigenous People of Color. And they have a lot of help even on the web. If it's BIPOC, and you can just put that on Google, and I'm sure a lot of stuff will come up, and probably even something that can help you.
I just wanted to piggyback off of what Dr. Williams was saying in regards to the community and how mental health is concerned. Right now, I know that the Department of the Department of Homeless Services, they have come up with a plan of taking all of the individuals in shelters and moving them to smaller hotels to control the spread of the virus. Now, that sounds great. However, how do we navigate through that actually happening? How do we operationalize that? How does that work for the clients, moving them, someone who has a mental disorder, moving them from what they know is being home to something else, to a different community? And also, how do we ensure the safety of the staff while we ensure the safety of the clients and the population that we serve? And I do agree, Dr. Williams, I think transparency goes a long way. I think that a lot of the weight comes on the staff members and the social workers in these positions, and we have to be strong, and we just have to know. There is no blueprint how to navigate through a pandemic. So I think a little bit of transparency goes a long way. I'm very transparent with the people I serve. Listen, we are experiencing this at the same time. I'm moving along just as you are. If you have any issues and concerns, come to me. I think that being open with people shows that you have just as much worry as them, but you do have the education and knowledge to lead, but we are both scared. And it's okay to let who you serving your clients know that you are scared, you're fearful, but we're in this together. I think that that's what I needed. I needed to know, though you may not be positive, I'm positive, but do I have your support? Are you scared too? Because I'm scared too. I think that goes a long way, having those kind of conversations.
Okay, Ms. Wilson.
I'm just going to add to the career piece that Maya was mentioning, as well as Tiffany. I think it's so important, especially as you're job searching, and I've been there, so I can attest that it is not just you're looking for a job, it impacts every area of your life. So how best can you work to ensure that you're at your best, whatever your best means? And I think now, especially, it's not time to compare yourself to the next person. You are dealing with your own situation, and you have to deal with it in a manner that works best for you. As Maya shared about the situation, the immigration situation or immigrant situation, I think also as immigrant was born in Jamaica, it's also, you also have to be okay with that. Sometimes you have to unlearn and relearn certain things in order to maintain your own personal sanity. So I think it's very important just to start looking at things from a different approach and just, recognize that taking care of yourself is not a bad thing.
And speaking of the workplace, with all that's going on between the pandemic, the inexcusable murder of George Floyd, a lot of people of color have been dealing with things such as microaggressions, whether it be with your boss or in meetings. So can you comment on how we can best deal with that? Because that adds another layer of stress, obviously, to what we're already dealing with.
I think I'm going to go from two perspectives, from the company perspective and individual perspective. From the company perspective, I think if as leaders of organizations, if you're talking about diversity and inclusion, it cannot be a checkbox, nor can it be something for the moment. Because otherwise, to me, from my perspective, you're doing more harm than good. So if it is something that you're really genuinely trying to do, as leaders need to get clear on, okay, is how important is this to us, and what are we willing to invest in it? Because the level of importance dictates action, and the investment also helps to say, okay, this is an environment that we're creating where all of our staff members can come to work. And if there's certain behaviors that we're not tolerating, because what you tolerate will continue. So if there's certain behaviors that you're not tolerating, microaggression, racism, what are the consequences when those behaviors are exhibited in the workplace? Because I think from an individual perspective, having to deal with that goes back to the conversation we're having about the mental impact and still showing up.
So you're dealing with all these things, you're showing up, but you don't necessarily have a place to go. So from a company perspective, are you building in safe places that can really ensure that you're addressing these things in a manner that's going to lead to positive changes? Because otherwise, if it's just a checkbox or is it the flavor of the month, to me, it's doing more harm than good, especially when individuals have to show up to work and deal with everything. From individual perspective, one of the things I'm going to say from personal experience and just perspective, okay, find the your truth. What is true for you? And also, when you have to take time off, take your time off, because you have to ensure that your overall spirit is in the right place. So when you go into work, you're able to deal with it. And I don't think also organizational leaders should have expectation that one person is going to solve this. It has to really be a full effort with the level of investment, energy, and everything included to ensure that some of those practices don't continue. Because if it's a policy and it's not being put into practice, it's definitely not gonna lead to any change.
Can I add something to that, ladies?
Absolutely.
I think for me, you have a responsibility as an employee as soon as you walk through those doors is to establish a certain rapport with your leader. And when you do that, you feel okay in being transparent and saying to them, I know what the world is facing. I know you watched the news last night. I know what you've seen and I've seen it too. And I'm uncomfortable today. And again, going back to what I said earlier, is being okay with being transparent. When you establish a rapport with someone in a professional relationship with someone, not 100% of the time are they going to 100% agree with you. But when you've done your due diligence in creating that safe space for yourself and your coworker, that is when you feel like I can articulate without being labeled as the angry Black woman, or being fearful that you'll be labeled as, oh, she just has an attitude. So when you take a part of that responsibility as well, I think it becomes more easier for you.
I just wanted to say or add a bit about microaggression and unconscious bias. I believe that systems and hospitals in specific should actually have a uh, a program, not only one time, but a systemic approach, maybe every month, every other month, maybe each department, to be taught about unconscious bias, things that we do and that we feel for others that are different, and also the microaggression. There are actually studies that show that microaggression increases our blood pressure and actually affects babies coming out smaller. Isn't that something? It actually does. A simple, small attack causes your blood pressure to go higher. So I think if we start at least with that and formulate ways in which systems can educate people, some people may be doing it without even knowing that they're doing it. So that's just my take on it. I think that could be a solution to at least a little bit of what microaggressions do. And it very easily system can do it by just forming programs that can be done monthly or every other month, or even make it mandatory, like they mandate for us to do infectious control. So why not unconscious bias and microaggression? That way, that could be a way of starting out to, health makes less disparities in healthcare.
I just also want to add to that, as you shared, having the program, but putting the money behind the program. It can't be we want to have a program, but we have no money. Because to me, when you start showing the money, you're saying what's important or what is priority versus what might not necessarily be priority. So definitely making the investment, not just financially, but also this is an investment across the organization. It is not the expectation of a certain level of staff. It is, as an organization, this is something that we're genuinely trying to address. And as a result, we're putting the money and the overall energy towards ensuring that we're making the systematic changes that are needed.
Yes, I definitely agree with you, Simone and Dr. Rodriguez, that it should not be a one-time thing. and the onus should not be on the minority individuals in the organization to fix it. So having, because sometimes people do certain things, like that's why it's unconscious, because you're not aware that it's going on. And it could be something as simple as you're walking down the streets and you see a black man walking with his, you see a black man walking down the street and you just put your bag under your, under your arm because you're afraid that maybe the black man will, take whatever it is from you. And at work, sometimes we experience microaggressions and, other people are not aware that they're microaggressing us. And going on to Dr. Rodriguez's point, there is actually a research study that says that women of color, they do have worse periods because of microaggression. So it does affect our health at the end of the day. And we do have one final question from Melanie. And that question is, how do we begin to have these uncomfortable, necessary conversations at work through groups meetings, education trainings if the agency is tiptoeing around racism?
I believe it goes similar to what I was just saying, that systems should make it mandatory for people to have a program that they have to pass, like we do infectious control as physicians and nurses, that you need to pass every 2 years. You need to take a test, even if you don't get anything. And instead of doing it just through the computer and you don't get everything you would get, the next time you have to do it in 2 years or in a year, you will get something out of it.
Something to say as well. I think accountability, like Dr. Rodriguez, if you don't adhere to the policy, and if you don't want to listen and you don't want to adhere, then you have to be held accountable. If you are making this an uncomfortable space for all of us, I may not have done it, but you make me uncomfortable because of your actions. So holding people accountable. Turnover rate, it may affect the turnover rate, it may not. You have to be held accountable for the things that you do in the workplace.
Thank you, Tiffany. I have one more question that I think is very important, and it's from Ms. Green again. She said that her question was, how do we begin to have this, the question was, verbalizing that mental health support for Black people can be difficult. What are some ways you suggest people go about seeking mental health support?
Ms. Wilson or Ms. Foster, would you care to take those question?
I'm going to add from a personal perspective, just looking at the need you have, because I think there was a time when we separated the mind and the body. And I think now we're getting back to realizing you need both. So I think it's from a personal perspective, looking at, okay, how is it impacting me overall? And recognizing that there's no shame, or there should be no shame to seeking the help. It's similar to if you had any other body part that had a problem, you'd go see that particular professional. So looking at overall mental health as a part of your well-being, your overall wellness, and using that as an opportunity to really reach out. And it could be also, in a weird way, reaching out to a friend, because a lot of us might be utilizing resources that we don't always talk about. So sometimes it could be talking about it from when you're stressed out, what are some of the things that you do? Who are some of the people you speak with, so that you're getting that opportunity to verbalize it and make it part of the norm, where it no longer becomes, quote unquote, that wall of shame. You're seeking help because it has to be your overall wellness. That's important.
I just want to say, like, maybe even a simple tactic for people to do out there if they're seeking mental health care. There's different ways you can actually go on the web. If you do have insurance, you can call your insurance company and see what services you're covered for, and if they have any referral or places that you can go. You can go on the internet and Google mental health in my community, see what resources are available, and I'm sure there are actually numbers and hotlines that you can contact. There's definitely more need for healthcare, mental health care physicians, psychologists, psychiatrists in the country for everyone. So even more so for our communities. But I think if you at least take those steps to go from there, if you have insurance, call your insurance company, see what they have in their website. If you don't have insurance, try to call or see directly what comes up that you can do, and then go from there. But definitely seek help. And if that doesn't work, then talk to someone you trust or someone you know, and they may have a better idea than you on how to seek it. Before we finish, I just want to say thank you very much for allowing me to be with you. And thanks to everyone out there that's doing so much good work and trying to get us through to this pandemic. And we as citizens should organize and give a little grain of whatever we can do to help each other to try to beat not only COVID, but racism and improve overall for the whole society.
Yes, would Simone and Tiffany like to give any parting words?
For me, I think being kind to yourself, this is new to all of us. The thing is, we're all literally all in this together because this is new to all of us, and it's happening across the world. So recognition that it is happening all over the world, and it's okay. Whatever you're navigating right now, it is okay. And just realize that there's a lot we can't control. We don't necessarily know when this virus or this pandemic will end. That we have no control over, but start paying attention and looking at the things. What are some of the things you do have control over, and some of the steps that you can take in that regard?
Tiffany, any last words?
Yes, for me, PTSD is real following something like this. We need to start talking about that more. A lot of us attribute PTSD with people that faced war or traumatic experiences. Who's to say that this wasn't a traumatic experience for me or for you, whether you were positive or not? And I think that we need to have more conversations around that. Utilize, if you're not ready to go back to work, you are not ready. You need to really focus. I know the bills have to be paid. I know that there's a priority, especially for families and single mothers. But if you're not ready, you're not ready. Utilize your resources, call your insurance, find out, like Dr. Rodriguez said, find out who you can speak to about this. And if you need an extension on whatever, these things are, read your handbook, go back and read your handbook from your employer so that you can educate yourself on how to, how to go back to work after following something like this. But PTSD is real, COVID-19 is very real. And if you're not ready, you're not ready. And I thank you ladies for having me, and it was a wonderful conversation.
Thank you. Alison, do you have anything to say, or would you like me to close it off?
See you back in 2 weeks, so July 23rd, we're doing men's health. We have the assemblyman coming and some other great male doctors to talk about men's health next time. That's all I have to say. And I really appreciate you ladies. You were all fabulous. Black Girl Magic.
Thank you for having me.
Yes. Good night, everyone. Thank you.
Good night, everyone. Thank you.